Hi, I'm Dr. Miguel Delgado, and I'm a board-certified plastic surgeon. And today we're going to talk about breast augmentation. Breast augmentation is the most common, popular cosmetic surgery performed in the United States. There's over 300,000 cases performed each year. The patient's satisfaction is extremely high, and women are very happy with the outcome. This video that you'll see takes you through the lives of 3 women undergoing breast augmentation, and these will take you over about a 6 months period of time. I hope you find this video very informative. So Leah, thank you for coming in.
No problem.
And I understand you're here for breast augmentation.
Yes.
How long have you wanted to have one, would you say?
About 2 years since I since I had my first daughter, and then I breastfed for a while, and then I noticed change in my breasts. And after I had my second child, it just increased that much more, and my breasts got smaller, and that's when I desired larger breasts.
That's a very common thing that I hear after having kids. The breasts get quite a bit smaller. What size are you now, would you say?
I'm a size a B cup.
B cup. And what size would you like to be, you think?
I would like to be a large C, borderline small D, whatever is appropriate for my frame.
Okay.
So
large C to even the D, huh?
A small D. What do you think is what would be good for me?
Yeah. Part of it is, do you want to look natural? Do you want to be a little bit over the top of natural, or how would you?
I do want to look natural. I don't want to attract too much attention, but I do want to have larger breasts.
Okay. When you were breastfeeding, how large did you get?
A large C.
Large C. And was that about the size you liked, or was that slightly small?
Slightly smaller.
Slightly small.
Yeah, I want, because the size I wasn't too accurate, because they were changing, swelling, and going down. So I was larger then, and I know that's about the size. I felt comfortable with that size, and I liked it. So.
Okay. Have you had any problems with your breasts at all? Lesions, pains, family history of breast cancer, or anything like that? Okay. No. And have you thought about what type of implant you'd like to have, saline implant versus a silicone implant?
I'm interested in silicone
For
a more natural feeling and look.
Yes. Yeah, I think in general the more natural implant is a silicone implant. The issue with silicone implants is detection if there's a leak. Silicone isn't really absorbed within the body, so it stays in there. So if there is a silent leak, you may not know it. So the FDA suggests a MRI at 3 years and then every 2 years to try and detect a silent leak. Usually I tell people to come back in, just take a look prior to ordering a test. The advantage of saline is that if there is a leak, it's water, it goes away. The problem with the saline implants is they don't feel quite as natural. There's rippling around the edges. So I think that in many cases for many women, silicone implant are really ideal overall. So I think that's a nice choice. Let me show you some of the implants and the various size implants, or the height of the implants. This is a silicone implant, and these are both 300cc implants. And you notice that one's taller, one's wider. So this is a high profile implant, and this is a lower profile implant, and then there's one in between. So to create a natural look on a woman, you want the width of the implant to fit the width of your chest, and that's very important. If you have a small breast size, width size, you don't want to have a large wide implant, or it's going to feel too high and too far out. So the implant companies now have given us a lot of different types of implants to custom fit each patient. So that's been a great advance, I think. And this is the scaling implant that you can see and you can feel. They're just very different. You know, one feels like a balloon, and the other feels more like a gummy bear kind of soft consistency. And now the implants are, conforming implants, and you can see how the gel can come out, but it goes right back in. So it's a great advance over the older implants, where it was almost like water or syrup. If it had a leak, it would really just spill out. Now these are conforming implants. The gel is conforming, so it conforms to the actual shape. And then there's a new advance coming out, which is the gummy bear, which is even firmer. So I think that the breast implants, silicone implants, have really advanced a tremendous amount over the last 10 years, and safety is not an issue.
I feel confident and safe with the implants.
There's been a lot of controversy about safety with silicone implants, and the FDA took them off the market for about 10 years. Extensive studies have been done and shown that they're quite safe. So, I'm very confident in saying that. But if there is issues, they have to be dealt with. And probably the most important thing to take away from this consultation is that breast implantation isn't really a one-time procedure.
Right.
So you're young, you're having the implants placed in now, they won't last you 60, 70 years.
No.
So if you get 15 years, 20 years, you're doing pretty good if you look at the averages. So what are the reasons why a woman may have to have them changed? One is hardening, which is probably the most common long-term problem. Deflation, rupture of the implants, do happen. There's no question about it. I've seen them with normally saline implants. I've seen them with silicone implants. They all fatigue. The outer cover fatigue. They spring a leak. And it becomes an issue that needs to be addressed. Infection, bleeding is not common. Asymmetry in my practice isn't common. We actually stitch you up during surgery, and we try to get it as exact as we can. Nothing's perfect, but we really try to get them as close as we can. Nipple sensation can be altered. Most of the time, there is a loss of sensation for a short period of time until the swelling comes down, and then it comes back to normal. Sometimes it changes. Sometimes part of it's lost. Uncommonly, it can be completely lost. So there's some risk there. There's no risk of breast cancer. You're able to breastfeed without a problem. So even in spite of these problems and the natural history of these implants, or that you will have issues, this is the #1 cosmetic surgery in women in America. So the the satisfaction rate among women are extremely high, just extremely high. So I think you should feel very comfortable about that. Okay, this is some examples of some photographs, and most of my patients have a perioral incision because I think it's a very cosmetically pleasing incision opposed to underneath or underneath the armpit. And remember, when you have other surgeries in the future, you're going to want to go through the same one. So you want to have one centrally that you can always access any issue. Underneath the armpit, you can't address all issues through there, or the belly button either. So I think the perioral is a great approach. I like putting them underneath the muscle. It gives you a much more natural look too. And here's some examples. This is about a 390 cc. She's close to a D. And I think you're kind of looking for this kind of size difference. That's what it looks like. And you notice the incision looks blends in really nicely.
I can barely see
it. This is, I wanted to show you one of the high profile implants. This is a smaller woman, 5'1", 105 pounds, and because of her small frame, you want to pick a smaller diameter implant, which is less diameter and taller, and then it fits into the chest area and looks natural, so it doesn't overfill the area. So that's what I talk about being natural. It needs to fit into your natural anatomy. Now some women want to be larger than that, and that's okay too. But I try to find out what someone wants, and if they want a natural look, then we try to go for that. If they want to go a little bit over the top with it, or even higher, it can be done. I think in general, the larger you go, the potential more complications you tend to have, because it's weight, it's gravity, and over time it just has more wear and tear on the area. So I think something that fits your body, I think long term does extremely well. Okay. Kathy, thanks for coming in. So I hear you're here for a breast augmentation and want some information regarding that.
Yeah.
How long have you been considering that?
Probably about 2 or 3 years.
Was there anything that prompted it?
Not really. I just felt like I wanted a little more volume and fullness. So wanted to look into it.
Did you do you want more of a natural look, or do you want something a little bit more than a natural look? How would you
More of a
term
natural look.
More of a natural look. What size are you now?
I'm about a 34B.
B. And what size would you like to be?
Probably a C or D.
C or D, huh? And you've never had kids, correct?
No, I haven't.
Are you planning to have kids?
Yes.
Well, breast augmentation won't cause any problem with having kids, obviously, or breastfeeding or anything like that. The only issue is that when your breasts get engorged and you breastfeed, if you breastfeed, the breasts stretch out and they change. So that's one of the most common reasons that women come back and have a revision is due to having kids. So just keep that in mind. But most women having breast augment, most of them haven't had kids yet. So you're a very, typical person that I see, a younger woman just wanting to have a little bit more enhancement. Have you thought about what type of implants you'd like to have?
Probably silicone.
One of the other things, that is important is sizing. What size should a woman choose? And it's always a major question, and women have a lot of confusion with, how large should I be? In my opinion, first is you never rely on a surgeon to pick your size. Some like them big, some like them medium. I think that really you have to do research into your size. And I think the best approach is like the Rice test. So this is what we have all of our patients do, is that a cup of rice equals 250 cc's, or a cup and a quarter of rice is like equal to about that size. So what you do is you put a cup and a third, cup and a quarter, and a cup and a half. Put it in your bra, go out, see how you feel. If it's obviously too big or too small, you kind of work it and find out what's ideal. And I think that is really the best way of determining size. You really can't look at someone else's pictures and things like that, because the amount of volume you have now is different than someone else. Your chest build, everything is very different. So I found the Rice test to be a great test for women, and I've had yet to have someone come back and say, really, I'm really the wrong size. It's something you don't want to have happen. So it relies on some like homework there. Lastly, we should talk about complications. Probably the most important thing that you should take away from this consultation is that this is not a one-time surgery, that you will require other surgeries in the future. I mean, you just have to count on it. You're in your 20s? 28 years old, and the implants won't last you 60 years. So what are the reasons that, you may have reoperation? Hey Laura, thanks for coming in.
You're welcome.
Now, how long have you been a part of our practice?
I would say at least 12, almost 12 years.
Really, that long?
Yeah.
Oh, that's fantastic. Thank you for coming back for this this surgery. Now, you're interested in breast augmentation now. And why now opposed to years ago? What's changed for you?
I'm done having kids.
And you have three children?
And I've always been kind of small, but that's been okay. And now I'm kind of small. The size I was fine, but it was small, but now it's kind of small and it's changed. So it's closer, more. I have to be more selective in what I wear, and the bra situation's kind of getting old. Too much padding, too much wire, and I just think it would be a really good positive part
Okay,
of
good.
my life right now.
Good. What size are you now?
Probably a 34. 34, I could fit in an A, but probably 34B, but that's a 34B, a little here, a little here, a little here.
So not a full B.
Not a full B, yeah.
And what size would you like to be, you think?
Well, I don't know. I don't go around asking everybody what their size is, but so I don't know. But I think staying 34 for sure, and kind of definitely being able to fill a B cup, a large B.
A large B.
A large, yeah.
Okay, so you want to stay very natural.
Yes.
On the smaller size.
Yes.
And you want to be more full overall.
Mm-hmm.
Okay. So C is probably too big, or?
Yeah.
Okay.
Yeah.
Mm-hmm. Okay, have you thought about which implants, saline or silicone? Have you given that a lot of thought?
I went with the one that felt the most natural, which was
The silicone
because I felt that.
Yeah.
So.
The advantages of, let me kind of explain about the implant. The silicone implants are more natural in the field. They're filled with a gel. One is lower and broader. So this is the high profile implant. This is a low profile or moderate profile implant. These are just some examples of some patients. These are before and these are after. Mostly all these women have a periareolar incision, so you can see how nice it looks. You can hardly tell. And they're under the muscle. I like putting them underneath because there's nice padding for the implant, and they look more natural. Yeah. Without question. And I think they hold up better and doesn't stretch out the skin as much. So I think in general it's a much preferred approach, even though the recovery is a little bit more uncomfortable
with this,
with underneath the muscle, because that's what kind of hurts.
Some women go without going underneath the muscle. They
do. Some do. I think, and definitely some do. Some doctors prefer it too. So I think it's a doctor's preference. It's a patient's preference. I think there's pros and cons of each. If it's put on top of the muscle, you often see the outline of the implant more. When it's underneath, you really don't see it quite as much. Okay. So I think it's much more advantageous underneath. And like, here's a lady who has some asymmetry. You see on her breast, and then after the implants are placed in, it's improved a lot.
She got 2 different sizes.
Yes, she got 2 different sizes, correct. Okay. About 50 cc difference or so. So that's just an example of pictures. But we've got lots of pictures that we show patients. You're having small implants. Here's a lady who's 5'3", 106 pounds, and you can see just, she's still a B, and it looks natural. Yeah. So.
Are these all yours?
All these are my pictures. Absolutely. All right. Thank you.